It is day 9, and we're talking about increased chronic inflammation. Now, if you've got acute inflammation, you've got redness, you've got swelling, but chronic low grade inflammation is far more insidious. It is what contributes to a host of pretty much every disease out there. And so, as we age, we become more inflamed. We have more inflammatory cytokines, and estrogen is one of those things that helps to regulate inflammation. And so as we lose estrogen heading into perimenopause and beyond, we start to increase baseline inflammation. And so we're even more at risk of autoimmune conditions, heart disease, neurodegeneration. There's a reason that all of a sudden women, it sort of flip flops. Men are more at risk. And then as we lose our hormones, women become more at risk. But it's really the inflammation that lights the fire. For example, high cholesterol in and of itself really isn't dangerous, but it's the inflammation that once the cholesterol goes in to put out the fire in the arteries and clean up the damage and get stuck, that's where the issues begin. I was just at a conference on the intersection between inflammation, cardiovascular disease, and neurodegeneration, brain disease. All things we don't want to be dealing with, but all things that we know as women steeply increase after menopause. So, what can we do? First, of course, how do we lower inflammation? One, it goes back to basics. Let's make sure that our blood sugar is stable. Let's make sure that we are sleeping well and have our stress management under control. Let's make sure that our gut health, that is kind of the open door, the gateway to autoimmune disease. And when we have any kind of an infection or pathogen or food sensitivity or parasite or high viral load, there's so many things that can worsen inflammation and create this cascade of events. But there's a lot of things that we can do to look for that on blood work. It's what I do with the women in my Hormone Harmony program. We're starting out with looking at all of the inflammatory markers. We're looking at a comprehensive gut microbiome test because that's where a lot of it comes from. We're looking at inflammatory markers there. We're figuring out, are there food sensitivities? How do we optimize thyroid and insulin and cortisol and sex hormones? Because those are all things that are going to help with that stress response. The other thing is it's an anti-inflammatory diet. And one of the most well-studied is omega-3 fats. So things like what I call smash fish, wild salmon, mackerel, anchovies, sardines, herring. It can be found in smaller amounts in flax seeds and in walnuts. It's very strongly associated with lower inflammation, bringing down CRP, bringing down antibodies, brain inflammation, and even depression. So if we can flip that, most of us are getting 10 to 1, 20 to 1, 30 to 1 when it comes to omega-6 fats and plant seeds versus those healthy omega-3 EPA, DHA rich fats. They are kind of rare in the diet and we need to flip that. And so this week, I would really like you to be focused on whether it is through wild caught cold water fatty fish. The little tinned fish are completely not exciting, but they're one of the most powerful and inexpensive superfoods that you can find. You can just kind of smash it down like a little tuna salad if you are open to something like that with a little red onion, capers, olives, whatever you like, or get some more flax seeds and walnuts. Our body can convert a small amount of that. And then look for a higher dose EPA DHA, something that is cold water extracted or CO2 extracted. Now, that is one supplement that I would strongly recommend not buying at a grocery store or on Amazon or anywhere because it is so easily damaged and it can become a rancid fat and add more inflammation to the body, doing the opposite of what we're looking for. So food first, salmon roe, if you can find that, or find a good quality supplement. And then, of course, the rainbow. Every deeply pigmented vegetable, herb, and spice is going to put out the fire of inflammation in your body and really help you to keep that inflammation down. And then, of course, just giving your body that 12 hours overnight where it can just clean house. It can clean out your gut, clean out your intestinal lining, clean out your brain. All of those things are going to go such a long way. And then identifying if you have some sort of a low-grade chronic infection, whether it's bacterial, virus, parasites, addressing that as well, so that we are doing everything we can to support our body in this nice, balanced, anti-inflammatory, healthy, optimized state.